Welcome back to our show, Preserve Health Talks. I'm Dr. Ira Pearlstein and my co-host, Lee again, and we're honored to have this morning Rabbi Mathew Durbin from Temple Bet Hayam, and he's also my beloved rabbi. Rabbi Durbin, thank you for coming on the show.
Oh, my pleasure. Thank you for having me.
Yeah, so I thought we'd talk a little bit about religion and medicine because every religion influences how people see their own health care. And particularly in Judaism, it affects me because I am Jewish, and it affects Leah the same way. But patients will incorporate their religious beliefs into their health care. So we're kind of exploring how religious observance, particularly with you here in Judaism, shapes and informs the way patients interact with healthcare in America. So, Rabbi Durbin, let's get started with a foundation. How does Jewish law view medical care in general?
Well, I think in some way to define it is to kind of look at where it came from. Right? We oftentimes say as rabbis, a doctor's certainty is a rabbi's maybe, right? Because there's hope, there's faith, there's belief. And I think with that hope and belief comes that understanding of, healing or some measure of healing. Medicine, and I should say the ability to provide adequate care has always been in Jewish circles, from 900 years ago with Maimonides to others. It has always been a staple, so to speak, in terms of how we access those practices.
Well, modern medicine originated in the Middle East.
Yes.
Because you were a heretic in England or in Europe in the 1400s if you saw a doctor because you were going against what they considered God's will.
Yes.
So Persia, the Middle East, was the foundation for modern medicine, and that's where modern medical schools came out of. So building on that, is there in the Jewish religion a religious obligation to seek medical treatment?
So we have a concept in Judaism known as pikuach nefesh, to save a life. And saving a life really trumps anything else that we do. I think the classic example is, say, with organ donation, right? Are we allowed to donate our organs when we pass? Or is everything that we have God-given, so as to say everything goes back to God? And Judaism looks at it as if you have the ability, especially as we pass, to give the gift to somebody else, whether it be our organs, our eyes. Jerry Orbach from Law and Order, and what's the one with Patrick Swayze? The movie Dirty Dancing.
Dirty Dancing.
Right. Jerry Orbach donated his eyes when he died, and that was a very Jewish perspective and a very Jewish obligation. So I would say yes, we do have an obligation medically to be able to use those God-given perspectives and how we train doctors in some way to be able to provide us with the tools and the ability to really help others.
Just to let our audience know that we're not being totally tangential here, Jerry Orbach played Baby's father in Dirty Dancing. He was also on Law and Order.
Yeah, for many years.
I take it that's where that was coming from. Okay, good.
So in your experience, how does the Sabbath observance of Shabbat impact decisions around scheduling medical procedures and accessing emergency care?
So, it's interesting because we look at it as Shabbat comes in Friday night, Saturday evening, we say goodbye to Shabbat. I don't know how many medical procedures are done on the weekend, but let's say, for the sake of argument, that one has a medical procedure that it is going to be scheduled for a Saturday. If it can be moved, I think that would be something that could have the conversation. However, if it was something that was mandatory and we didn't have time, so to speak, I would say that ability to save a life you violate Shabbat. Absolutely. Can I
So-
give you an example?
Yeah, sure.
Okay. So this one's a little bit personal. But my father had a quintuple bypass surgery. So my dad had said, what do I do? Right? The surgery's scheduled for this. It happens to be Shabbat. I don't know what to do. And I said, Dad, let me make it very clear. You're not leaving the hospital unless you get that procedure done. In order for you to survive, as the doctors and physicians and healthcare professionals have said, you don't have the luxury of days and weeks. It is more immediate. So I think in that case, yes, absolutely. I mean, same thing with the high holy days or any of our major festivals. I think our health and the ability to provide care is tantamount to anything that we do.
So that's the overriding factor. Now, how does that also relate to Jewish dietary laws, keeping kosher? And if you're in a hospital that doesn't offer kosher food, the patient, you can't starve them. And a lot of medications have ingredients which are considered non-kosher, and some of them even have pork product base med.
So I think in that extreme case, I think Jewish law would slightly say, in order to survive, bekuach nefesh, to save a life, is the most important, right? We see that in some way, not to make the analogy with the Holocaust, but we know that in certain, Nazi concentration camps, they were fed, pork, or they were fed other non-kosher food. They didn't have a choice. I mean, either we eat or we don't. And if we don't, there are challenges. I think in regard to the laws of kashrut and being in hospitals, there's also Ensure. There are other ways of getting nutrients and supplement into the body. So I think in that regard, most very traditional or observant Jews may opt for that, to say, as long as I can get the calories and I can get what I need to survive, I just can't eat those type of foods.
Okay, 2 follow-up questions to that,
Yep.
both very brief. So I'm a cardiac surgeon, for example. I'm not a cardiac surgeon. My patients know that. But let's say for the example of this question, I am a cardiovascular surgeon. And you have an aortic valve that cannot be fixed. And I offer you 2 choices. I could say I could put in a mechanical valve, but that mechanical valve may come with complications. You may need to be on blood thinners the rest of your life and have an increased incidence of having a stroke. Or I could put in a porcine valve, a pig valve. How would that affect you if you kept kosher? And would that be an exception? That's one example I'd like to have
So
you address.
that is a great question, because I think, and I should preface by saying I am trained as a Reform rabbi, which is to say I take our tradition seriously, and I accept certain undeniable truths, but at the same time, it's also about embracing and trying to find that healthy balance between modernity and the Jewish world. I think in that case of having, say, a pig valve, right, if it is to extend your life in a way that makes that more possible, as a Reform rabbi, I would say absolutely. If I was an Orthodox rabbi, I probably would opt for the first. But the challenge with that is having the knowledge of, will I have complications? Will it leak? Will it, what's my quality of life that I will have? And at the same time, how long are we extending? I mean, if we're talking an artificial valve and it lasts 2 years, as opposed to a pig valve that could last 15 years, I think you need to find that balance to be able to say what is most important. I would say as a Reform rabbi, and forgive me, I'd go for the pig heart.
Okay, and the second example, and we see this a lot with measles outbreaks, and we see measles outbreaks in various communities, and we see them sometimes in Muslim and Hasidic, very religious, observant Jewish communities, because the measles vaccine is purified in pork gelatin. What are your feelings on that?
I put a lot of my faith and my belief in physicians, in medical research. I think it's important. But at the same time, I also have to be cognizant of the community, right? When we look at certain outbreaks that have happened, especially in the Hasidic community, like in New York, or just outside New York City, I think that there is the understanding that in some way this is human intervention, not divine intervention. Although I would argue and say human intervention is given by the knowledge and the skill to which God has allowed us to pursue. I think in very ultra-Orthodox communities, they don't want any intervention. It's, as they say in Hebrew, Ken Yehi Ratzon. May this be God's will. If this is the way that my life is supposed to be, so be it. But again, I think that there are ways throughout that we are able to best protect ourselves. I mean, it's the same issue with vaccinations. I'm a big proponent of vaccinations. It helps me. It helps my kids. We grow together as a community. But at the same time, I'm also cognizant of those who do not, that there are challenges with it. And I think we need to be aware of those.
Okay, Leah.
When it comes to end-of-life care, such as DNR orders or withdrawing life support, what are the views in Judaism on that?
Wow. That's a tough one. Right? We would say to extend one's life, we again need to look at what is the quality of life, what is the care that is provided for, and how do we really go about that? And I think in some way, end-of-life care is a really challenging one, especially with, and forgive the expression, but pulling the plug, right? Does Judaism say you could pull the plug? No. They actually say you are to have as much as you can before those type of interventions. And I think in some way it's really about the quality of your life, not the quantity.
You had mentioned modernity, the modern world. And the modern world sometimes is conflicting with ancient Jewish law, particularly when it comes to reproductive health. So reproductive health can be a complex intersection of religious law and modern medicine. So how do observant families navigate issues like contraception, in vitro fertilization, or fertility treatments in general?
So that's a great question.
Well, thank you.
Absolutely. When you look at those type of medical practices, we know that IVF was not there 2,000 years ago, although I'm sure somebody could argue. Right? We know it wasn't there, but the ability for one to reproduce, and when we look at Judaism, that is the most important thing that we as Jews can do, right? It's the reproduction. It's the ability to provide for the next generation. Right? If we look at one of the controversial issues of abortion, for example, I mean, Judaism makes it very clear. Absolutely not, from a very traditional perspective. Right? They say, in some way, abortion is off the table because, in some way, if you engage in that activity, you have to be prepared for the consequences. And in some way, if we have those consequences, in some way, it's saying, well, you can't abort just because, well, I'm young, I'm dumb, I'm, whatever it may be, or I feel financially insecure, I just can't bring a child into the world. Judaism would say, that was your choice. Now, when you look at abortion, the fetus inside the mother is one entity, right? And Judaism actually says, in the event that the mother's life is in jeopardy, and that's the only exception, is that you may abort. But we can't abort just because and it's not as if Judaism, in that regard, would abort at 9 months. It's just not possible. We would say maybe first trimester. But there would have to be something that the mother's life would be in jeopardy because in some way the fetus is still feeding off the mother. They're one entity. And I should say mystically, which we have in Judaism called the Kabbalah, or the Kabbalistic understanding, the mystical aspects behind Judaism, actually looks at it and says, life does not begin at conception, as many of our co-religionists understand it, that we understand life as body and soul. Body in utero, and as the fetus exits out of the birth canal, whether it be vaginally or C-section, right, when that child takes that breath of oxygen, that child is then given a soul by God. And body and soul equal life.
So, what challenges do observant patients face when navigating the traditional American healthcare system, and how can doctors and hospitals be more sensitive to those needs?
I think one of the big challenges that we have is the understanding of theodicy, right? The I'm sitting in a hospital, I've lived a good and deserving life. God, why have you afflicted me? Why? Why am I here? And I think for physicians, it's important to know that difference between somebody who is observant and somebody who really needs the background information. You know, I think one of the challenges I get as a rabbi very often is the comment that says, "Forgive me, Rabbi, I'm not religious." I'll stop you right there in mid-sentence. As a Jewish people, we are religious. It's about observancy, right? So we could say, "I'm not the most religious person, Rabbi." Well, it has nothing to do with that. Or, "I'm not the most religious doctor." Well, it's about observancy. How do you bring that observancy level in a way that a physician is able to talk through what some of those challenges that you're faced with and how they can get to the point where one is most comfortable?
So we're running out of time,
come
and we're going to have you back.
Come on.
You know, these shows are short and they're a segment, and you're going to see it on our YouTube channel at Preserve HealthTalks, and you can find it on Reels on Facebook. But we're going to have to end it right now. But we're going to bring you back.
Can I just add one more thing?
Sure.
Okay. You know, when I was in rabbinical school, I took a class on Jewish medical ethics, and this was fascinating. This was coined by one of the former chief rabbis of the United Kingdom, Emanuel Jacobovitz, who coined the phrase Jewish medical ethics. And as I was doing research, it was about the conversation of disclosure. And this I found fascinating, is that if you go back 60 years ago, not long ago, something like 70%, 80%, 90% of what doctors disclosed to their patients was not full disclosure. They left things out. Today, as you know, you'd be morally and ethically irresponsible if we didn't explain what was the full picture. And as we unpack it, it goes back to that one single, simple value, which is hope. Is that if I can't give somebody hope, they may take a spiral turn. Or, in some way, without the hope, why am I living? Why am I here? What's the purpose? And I think Judaism adds great purpose and meaning to what we do.
So you'll come back on the show?
Yeah.
Can you hear its own?
Can you hear its own?
So may it be God's will. It's a pleasure having you today. Thank you so much for being on Preserve Health Talks.
Thank you. Thanks for having me.